Naka, thank you for your presence today. I must acknowledge the role that the media has played in our pandemic. Much as we've had a little bit of a difficult relationship over sometimes, but I appreciate the fact that questions need to be asked and has to be answered, and we've tried to keep the public as informed as possible. We have had to try and ensure that what we narrate was devoid of any other agenda but the medical agenda, and that has been something that's been a bit of a struggle for us throughout the whole pandemic. But it is what it is. I don't think we are the only country in the world that was struggling with this. There seems to be that almost every other country in the world that have tried to install public health measures have had to deal with agendas that are beyond that of health, and so we've had to try and mitigate some of the way that information is brought across when you have to deal outside of health, when you're trying to look after other people's agenda. But for the purpose of promoting, I think that overall we have done quite well in trying to keep to the message of promoting the public health agenda in the public space and getting the public health agenda out there. We also have to thank all those hardworking frontliners who, for the past 6 months, have had to, put their body and souls on the line in order to try and mitigate the effects of the COVID-19. We've had a whole of government response. We had members of the civil society, those in the private sector, who have lent us a helping hand, especially during the dark days of the second wave. And we have to appreciate, and I really thank them for that, for their contribution. Yes, whilst we are lifting more of our restrictions on November 11th and opening up our international border, we have repeated time and again in all our public advice that COVID-19 will still be around. I keep on cutting and pasting the same message, but with some changes in the sentences, just to reiterate the point that COVID-19 is endemic. The virus is going to be around. It's not going anywhere, not getting out of this country. And if we are looking forward, it might even, if I put it bluntly, it might even help us later on. We now know that based on all the information we're getting, that when a vaccinated person gets infected, their protection is better and their chances of recovery is better. Their chance of recovery is better and their protection is better when a vaccinated person gets infected. And in fact, there is a good chance that as the world evolves, that will become a booster dose. Okay, there's very good chance that will become the booster dose in much the same way as Spanish flu has evolved. Started in the 1900s, we've had recurrent pandemics of Spanish flu. The last one was in 2009. I don't think anybody talked about it when it was hitting Fiji, but we in the medical community, we felt it. Then we dished out some flu shots. If you remember, we dished out flu shots after 2009 to all the pregnant moms, and that was still dealing with something that started in the early 1900s. So I think that it's important. Basically what I'm trying to get at is that if something like Spanish flu started from the 1900s is still around, and the same measures that prevent you from getting Spanish flu are the same measures that prevent you from getting COVID-19. When Spanish flu came out, we got everybody to mask up. We did the same thing. We wash your hands, physical distancing, and now we repeated the same instruction again with COVID-19. So, this is most of the COVID-safe measures are just going to be a reiteration of many of the past measures. But given that it's going to be endemic, given that we still have a significant proportion of the population that are not going to be vaccinated, we know that. Those who are vaccine resistant, plus we still have got a lot of children that we're trying to see if it's safe to give them vaccines. We also know that the vaccine is not as efficient in providing herd immunity as our traditional vaccines like the ones against measles. We also know that. That's a fact that we can't escape. So given all those matters, we have to be very blunt in saying, we give you the vaccine to slow the virus down, but it's up to you to make sure that the virus doesn't get to you. That's our message out there that we want to promote. The Ministry of Health can only go so much. Beyond that, you have to engage in your health-seeking behavior and in your COVID-safe measures. I have no doubt that a lot of the public of Fiji have sacrificed a lot in this second wave of the pandemic. They've adhered to all our lockdowns, our restrictive measures. Livelihood has been impacted. I do know that at the peak of our restrictions, when people were not allowed to go out of their home and they were stuck 24-hour lockdown, I knew that we were going to be rocking with a magnitude of revolt if we did not do something a bit more, if we became less stringent. And this has been a path that we have all navigated for a long time. Whilst it is good to do COVID-safe measures and mandate COVID-safe measures, unfortunately, all those mandates will affect livelihood. And people need to eat. So there is a social responsibility that we have in securing social and economic livelihood for Fiji. There is just no other formula that will work. If there was another formula that we could engage social and economic recovery in a safer way, we would have engaged it. The only way we have to engage it is engage it in the way that the world has panned out as it stands today. Everybody vaccinated, a disease that is persistent, a vaccine that is not giving us total herd immunity, and a big group of people that are going to remain vulnerable. Within that context, that means we have to share the responsibility. We do what we can, you do what you can. COVID-safe behavior for the public, COVID-safe engagement of all the workplaces, COVID-safe conditions for the schools. That's what everybody else needs to do aside from us carrying out our vaccination program. As we get closer to, for the size of our country, we've paid a great price for COVID-19. Many died during the peak of all the deaths. We had extra mortuaries built up. There is no doubt in our minds that a lot of suffering happened because of COVID-19. There is no doubt in our minds that there would have been room for improvement if we had a chance to improve. We have learned many lessons from the effects of COVID-19. We do know that there are a lot of the deficiencies that we had in our response are deficiencies that have been there for many, many years. The problem was that we were able to make the changes, but we had trouble in scaling up the change. When the acute cases started to escalate, our problem was in scaling up to match the escalation. That was hard. Even though we had the answer, scaling up to meet the challenge was hard. It was clear to us very early on that in the Central Rio Division, when the disease broke out, it broke out with low vaccination rates, but unfortunately also within a very highly populated area, the Central Division. So we saw the cases shoot up huge in the Central Division, requiring so many mortuaries, extra spaces, and then slowly subdivided. We were successful in making sure that the disease moved progressively throughout the nation rather than in one go. That was our game plan when we knew that we couldn't control the outbreak in the Central Division. Our game plan was to hold the disease in the Central Division for as long as possible Get the Western Division vaccinated as much as possible. Prepare them with all the care plans and all the line listing management that we could before the disease broke out into the Western Division. And that's exactly what it did. Whilst we were there in Western Division, we have progressively vaccinated the Northern Division and all the maritime islands, sorted out their line listing and all their care plans, whilst now we are now sending our repatriation people across. And no doubt, COVID-19 is already in the north. We just haven't picked it up. I have no doubt in my mind. But it's there at a time when we got a good vaccination rate, when you got medical teams that have reorientated their management into line listing and care plans, and I think that we're in a good space. The success of our program has been in that the peak of the disease in the West was far, far less than the peak of the disease in the Central Division. And you differentiate the two, the Central Division, actually we achieved a world record in the Central Division by peaking within the Central Division. You would have imagined what would have happened if we had the whole of the Western and the Central Division affected at the same time. That would have been a different matter altogether. As we move closer towards our 100%, we know that we have to strengthen our resolve with regards to the third wave. The third wave is not a matter of when or if. It's not a matter of if, it's a matter of when. It will come. If anything, the third wave will be an escalation of the current Delta virus as it is right now. The third wave is more likely going to be because we have relaxed in our COVID safe measures, because we have congregated, because we have allowed more funerals to happen, because we have not maintained COVID safe behavior within those funerals. That will be the most likely source of our third wave, not from the external threat. We have border protection set up. Our border protection unit is currently well in place. So they've got a laboratory that will be opened up sometime around mid-November to support the functions of the border health protection unit. They've got a building for themselves within the CAF compound. If you get, probably when PM goes to open it, and then you'll have a view of it. So all those are starting. We've started all those processes. I've had discussions with immigration on the digital platform that will screen people when they come in. We are hoping that a lot of our screening is done outside of the borders of Fiji, so that by the time they come in, we're not having to apply too much in-country screening. And as you have more vaccination and better screening process, we can cut back more and more on quarantine. Okay, because the protection will be from the vaccine and from the pre-departure screening process, so that we do less of the in-country. So as we do less of the in-country quarantine program and screening, that means we can improve our ability to we have the greater freedom of facilitating social and economic leverage. I think I better stop there. They gave me a few more things to say, but I think it's should go back to allow. I know that PM has mentioned about masking. We got all the indoor public areas, public transport, and the crowded public settings, like markets, shopping malls, and bus stands. Those are the only areas that we have mandated for masking. So that means if people walk around in open space and they're maintaining good physical distance from each other, you don't need mask. See? If I go down and walk along the road, I don't need a mask. But as soon as I keep a mask with me, as soon as I come past a group of people that are standing close to each other, I just slip the mask on, walk past them. Then I take it off again. And that needs to be the habit that we all get. You walk with your mask. You judge the situation when you put on the mask, and you judge the situation when you take off the mask. And if Fiji gets very proficient in that type of behavior, we can. When we get a third wave, the third wave will be a small wave, not a tidal wave. I think I've covered the rest of what is in my brief to mention. We have to still remember that our COVID safe behavior is still required because of the vulnerable. There are some people who cannot mount a very good immune response. There will be people. We'll try to mop them up with a booster dose, especially with the focus on those group of people, the vulnerable people, over 60, under 60 if they got comorbidities, and then the under 60 also will be the frontliners. We are working on getting booster doses for all of that group. As you may understand, the frontliners were among the first to get it, and the vulnerables were among the first to get vaccinated. So we expect that the immunity will start waning very soon. Having said that, they also, like I said, the booster, we can give them the booster, or they might have already got the booster laterally. I think, Semi, you got anything to add? Otherwise, I don't have much more to.
I've got nothing else to add. I guess just to add the media platforms on, just to say thank you for all the the COVID safe measures that you initiated and you put up on your own. They were very helpful. We had some that went out, but you also took effort to get your own from the various sources around, and you put it up. And on occasions, I'm a little bit off, but generally the message was good, and so we encouraged, and we were thankful that that added to our effort, and I think it made a lot of impact for our people in getting the message across, and for them to respond in terms of behavior. Otherwise, PS has covered all the other bits, and generally that's where we are heading.